I want to thank you, American Liver Foundation, uh, to provide me this gracious opportunity to participate in this. I was assigned the topic of liver function and liver disease, which is a very basic topic to understand how people develop liver disease. I have no financial conflicts of interest to declare. So my topic covers the following questions. So first of all, I'm going to talk about how the liver functions and what role liver plays in our normal physiologic system, and then how we acquire a liver disease. And thirdly, we're going to talk about the different types of the diseases which people may suffer from, and then how to establish or who to evaluate liver disease. And then finally, I'm going to briefly talk about how to prevent a liver disease. So let's talk about the first thing, why the liver is important, what role liver plays in our physiology and the body functioning. Before I talk about the functions of the liver, I will go over briefly with I want to spend a moment to talk about how our food processing system works. So when we eat something, when we put some food in our mouth, and immediately the body sends some messages to stomach via brain or hormonal system to get ready to set the stage to take the food. And then once the food get into the stomach behaves like a blender, just like a food machine blender, where it mixes the food, churns the food into a paste-like material, which is called chyme. And that chyme contains a partly digested food. And then this chyme is transported into small intestine. And there, in the small intestine, with the help of further juices from the intestine, it is converted into the basic nutritional molecules, such as fat molecules, protein molecules, carbohydrate, vitamins and minerals, such as the sodium, potassium, calcium, iron, etc. And these basic nutritional molecules are the basic nutritional units or absorbed into circulation in the intestine, and then then it goes through the blood. All the nutrients goes to the liver, as you can see here, and then further processing happens. And now the liver play a very crucial role in the resynthesis of the new molecules according to the body's need, and then they are delivered to the rest of the body, especially to the muscles, to your glands, your brain, your fat tissue, and then the surplus food is stored into the fat tissue. The key point here, there are several neuro or like a system works, and in addition to that, there are several hormonal systems come into play to take over or to process this food system. One of the key factors here is in the food processing is the insulin hormone, which play a very fundamental role, especially in the liver for the processing of food. So this slide shows that the food, after being absorbed, is delivered to the liver. As you can see here, this is the blood vessels taking all the basic nutrients, absorbed nutrients, taking it to the liver. This is called the portal venous system or symplectic circulation. And through this, it goes to the liver. And then in the liver, as you can see, this cartoon very elegantly describes the basic concept of the food processing that happens in the liver. As you can see in this right side on the upper corner, this cartoon describes that the food is coming, the nutrients are coming into the liver, and then they are processed. So the new proteins new carbohydrate molecules, new fat molecules are produced according to the body's need, and then they are either stored or delivered to the, as you here, this is the incoming out and the incoming system, and this is the outlet, and this is going here, and this is turning out to the rest of the things. So the sugar, proteins, fats, and the rest of the things, and they're delivered to the body. So I like to say that liver performs two basic functions. What is it's a recycling factory. So it takes the raw material from the stomach and intestine and reprocess to the new basic nutritional molecules according to your body's need, and then they are stored in the liver. And then it functions as, in the modern language, in the modern world, it is an Amazon of the body. Whenever anything your bodies need that, it put an order, the order goes to the liver, and then liver synthesize and deliver to that particular organ and the tissue. And that's where the homeostasis of each nutritional component is maintained. So there are several factors that affect this food processing system and the liver functions. And among that is one of the key factors that plays a role is our lifestyle. So what we eat, how much we eat, what time we eat, it all matters. What time we sleep, it matters. And then on top of that, like the drugs, the medication, everything that goes to the stomach, it goes to liver. First, it's called first pass effect, as is shown in the previous slide. Aging does affect the food metabolic system. Genetics, yes, if there's something wrong, if we inherit some abnormal genes, and that may affect the food processing system. And then liver disease in itself. If something goes wrong with the liver, and as the liver gets worse or damaged or injured for some reason, then it subsequently affects the further food processing system, and certainly it becomes an inefficient system, and it becomes a vicious cycle. So what causes liver disease? How we acquire the liver disease? The liver disease is primarily the disease of lifestyle. Vast majority of the time, we hurt our liver by ourselves. If we don't do anything wrong, and if we spend the life with as healthy principles, it doesn't cause any damage to the liver. So in 90% of the time, or the vast majority of the time, we do something wrong to cause liver disease. So here are some common mechanisms that explain how we acquire liver disease. The first and the most common thing that happens in this era around the world is the insulin resistance, meaning that the impaired insulin function. It is not that the body lacks the hormone, lacks the quantitative deficiency or have a less hormone. Rather, it has a sufficient, or rather in excess insulin hormone is produced, but it does not function. There's a discordant between this demand and the supply of the hormone. So there's no match, and that leads to the malfunctioning of the system. And as a consequence, our body produces more fat because the food we eat is not processed and in fact is converted into fat as a consequence. Alcohol and substance abuse. This is the recreational activities. Yes, we love to enjoy, with fun, but we have to pay the price. Infection, if we're not very watchful, and sometimes the most common infections such as the hepatitis B, hepatitis C, they come with our recreational activities or fun activities. Hepatitis A or other things, it may come with the food, like if they're not hygienically clean. Immune system dysfunction, it may be partly related to the genetic factor and partly related to the environmental factors, like the way we take medicines, the toxins, herbal things, or sometimes the infection precipitate that. Genetics is genetic diseases such as alpha-1 antitrypsin, Wilson's disease, or hemochromatosis. They are not common diseases. They are rather rare diseases and maybe accounting less than 2% of the entire liver disease patient volume. So here are the things that can cause liver disease, and that is in our daily life. As you can see that the first on the left-hand corner here is how much we eat, the food we eat, what time we eat, what quantity we eat. It does matter. So if we are not watchful, we're going to eat bad quality carbohydrates, such as sugars, sugar beverages, or if we are not watching, we may be over-consuming saturated fat, which is a bad quality fat. And the bad quality fat comes from animal sources, such as fat that come with the meat or with the dairy products, such as a heavy cream, whipped cream, cheese, etc. Alcohol, yes, we love to enjoy. It's a good thing to relax. But the important point here is that a American Heart Association does recommend moderate alcohol drinking, which is 2 drinks for a man and 1 drink for a woman. But the safety effect of alcohol drinking as regard to the liver disease has not been confirmed. Yes, we believe that it's most of the time with moderate drinking is safe, but if somebody has a liver disease from some other reasons, for example, hepatitis C, hepatitis B, or non-alcoholic steatohepatitis, drinking like such as a moderate drinking on top of it have a bad consequences. So it is not wise to drink alcohol if you're particularly having some underlying liver problem. Again, some other fun activities such as tattooing, body piercing, or drugs use, illicit drug use. It's not without price. It may be associated with a hepatitis C infection, HIV infection, hepatitis B infection, and some other infections too. And these drugs can cause direct toxicity to the liver as well. So there is a direct effect and the indirect effect. Sexual activity, a promiscuous sexual activity, or unprotected, unsafe sexual activity can lead to hepatitis B, which is the most common mode of hepatitis B infection. Again, this is a slide that shows the flood of fat flood, meaning that if you consume too many calories, we are filling our stomach with too many calories. As an adult, our body typically needs between 1,500 to 1,800 calories a day for a normal person. But if we eat more than 1,800 calories a day, like 2,000 calories or 2,400 calories a day, certainly we are eating in excess, like 25%, 30% of excess calories are going in our body. And these calories will not be consumed. And in fact, they will be converted into stored fat. And that stored fat is going to be stay in the liver, because the liver is the warehouse of the body. And then at some point, it's going to become overflow fat, and it goes to everywhere, especially in the stomach area, in the mesentery, or outside the stomach. And that overflow fat is going to cause problems such as steatohepatitis, atherosclerosis, heart disease, etc. So what type of the liver disease one may have that? So there are 3 types of the diseases that may happen. One is the parenchymal disease, which is the most common variety. Parenchymal liver disease means that the disease that affect the hepatic cells, the liver cells, the basic unit, the basic functioning unit of the liver. And once that happens, it uniformly involves the liver. And that even a small piece taken from the liver can tell you what's going on with the parenchyma. And the second form of, the examples of parenchymal liver diseases are such as infections, such as hepatitis B infection, hepatitis C infection, non-alcoholic steatohepatitis, fatty liver disease, autoimmune dysfunction, drug-related toxicity, etc., or alcohol liver disease. Focal liver lesions is the second mode or second type of the liver pathology. It means that there are focal lesions there are not the entire liver is involved, but there are focal small nodules, which may be present at the time of birth, such as a cystic lesion, or maybe after the birth, people may develop focal nodular hyperplasia, or such as if hepatic adenoma. These things can also be altered by taking over by our behavior. For example, taking an estrogen can accelerate the growth of these benign tumors, such as a hepatic adenoma or hepatic cyst, and that can subsequently can cause problems such as obstruction or creating the mass effect. And then cancers. The cancer can happen inherently right inside the liver, which is primary liver cancer, or it may be coming from outside as a spread from colon, from breast, or from other organs such as lung. So this slide shows kind of how the parenchymal liver disease look like. So the most common symptom of parenchymal liver disease is fatigue, inability to perform daily functioning, easy fatigability, and it may manifest with abnormal liver enzymes. And on the ultrasound, you can see the liver may become more heterogeneous, meaning that it's more achogenic, means that it's more brighter looking. So normally the achogenicity, which is the brightness of the liver, is same as the kidney here. But here you can see the kidney, this is the kidney, and this is liver. And you can see the kidney here is much more darker as opposed to the liver, which is much brighter. It means there is something is going wrong with the liver. It may be fat, it may be inflammation, it may be scarring. Most often the radiologists report as a fatty liver, which is a misnomer, but practically this is a chronic liver damage. This is a parenchymal damage. So we cannot differentiate hepatic fibrosis, fat, or inflammation on sonogram. We need further testing to confirm that. And this is a microscopic pathology report, and here you can see the black spots here that reflects the inflammatory cells in the liver. So there's the inflammation going on in the liver. And then when the disease steps further, advance further, can lead to, like this is a autopsy specimen showing the advanced degree, and it becomes like a rotten liver. And this is a fat with a cheesy liver. So it can cause. And this is a polycystic disease, like the patient who have a cyst, multiple cysts in the liver. As you can clearly see that this is a cyst here, this multiple cysts are shown here. So this patient has a congenital liver disease, and that developed at the time of birth, and he carried on all the cysts through his life. And at some stage, it becomes a significant problem and required a liver transplantation. So this liver was an explanted liver, showing the pathology. This is a hepatic adenoma, the tumor on the surface of the liver. This is the focal area. Rest of the liver looks quite normal. And this thing can happen as a result of, again, iatrogenic, taking the medication, especially this kind of a tumor is associated with estrogen intake. Again, this is self-inflicted, or medications we take that can cause liver damage. This is my favorite slide, and that shows the natural course of the liver disease. So the disease, once we get exposure to the pathogens or over behavior, are the things that can cause liver damage, and then it initiates the process of liver damage. And then from the beginning, it goes from normal liver to the early stage of the liver damage. It does not really matter what causes the liver disease, whether this is a hepatitis C, hepatitis B, non-alcoholic steatohepatitis, fatty liver disease, or immune dysfunction, or drug-related or toxin-related injury, or alcohol-related liver injury. It leads to the same common pathway or consequences. Yes, on the microscopic examination, one can differentiate between the different types. We have a blood serological test to differentiate what is causing that, but it follows the same common pathway. And then it started, the disease started the early stage, stage 1, stage 2, stage 3, and then it becomes a cirrhosis. And once we call cirrhosis when the liver damage is quite extensive, when it has almost more than 2/3 of the liver is scarred liver or is a dead liver, and that's what we call it cirrhosis. And at this point, we are living as one is living with a bare minimum healthy tissue. And once we set to this stage, this is a red flag stage. It means high in the near future. And if we do not care, and if we do not take actions to prevent or treat the underlying problems, then it can lead to further consequences such as varicose veins in the gullet, which may rupture, or ascites, fluid accumulation, and like liver failure, becoming jaundice, losing muscle mass, or losing the function and eventually developing cancer. So at this stage, these are the first line complication. And then the second line complication happens, like if we have varicose veins, they can bleed. If you have ascites, it can turn into infections such as spontaneous bacterial peritonitis or acute kidney injury. If somebody has a liver failure, it can lead to further bad consequences with a high MELD score. So the liver loses complete function, and all of a sudden the MELD score, which is a reflective of liver function, and it stands for model for end-stage liver disease score, it starts 6 and it goes up to 40. When someone has a score of 40, it means that the risk of death is quite imminent, and that's what the people need liver transplantation. So this, at the end, everything, all complications turn into the liver failure with a high MELD score, and at that point, either someone get the liver transplantation or they die. So identification of the problem and complications and consequences on these scales are very important. So the disease starts from exposure of pathogens or toxins, and it moves on this scale. When we identify that, and if we correct or rectify the underlying problem, then the disease can be reversed. We have a sufficient scientific evidence to prove that any disease which can be treated, such as a cure of hepatitis C or control of hepatitis B infection, stopping alcohol drinking, or treating autoimmune hepatitis, or treating fatty liver disease with lifestyle and prevention, watching the good diet, it can reverse the underlying problem, and the disease can get better even from at any stages, and then eventually turning down to decompensated liver failure, to compensated cirrhosis, and subsequently down the further lessening the scar tissue in the liver. This is here kind of other representation of the previous slides. So this is the exposure. So we use a tattooing, body piercing, alcohol drinking, poor lifestyle, anything. All the lifestyle changes, and eventually leading to the liver damage with the fat, like fatty liver disease, and inflammation turning into cirrhosis. That's kind of esophageal varices, which was bleeding and requiring treatment to stop bleeding, and ascites. And this is here as a cancer, liver cancer, and the patient with the liver failure with the high MELD score requiring ventilator support and waiting for the transplantation. So the next section of my talk is whom and how to screen for the liver disease. Certainly, it's a life-threatening condition, so we have to take an initiative and steps to identify the problem sooner in the disease course, so we can prevent the progression. And if we find the disease in the middle on the scale, as I mentioned previously, at any stage, we need to take serious actions and stronger actions to identify the underlying problem and treat them, and then get the liver better and healed. Liver scar can be healed. It decreases with underlying treatment of underlying problem. So how do we evaluate it in my practice? So first of all, when we see the patient, we identify what are the lifestyle changes the patient has, that how the patient spend their life, how the patient spend their day, most of the days in, days out. So we get detailed information. We get the very personal information. And then we see how much the lifestyle he has, what kind of food patient eat, how much where, and then exercising, activities, job, work, home, pleasure, fun. All these informations are very important to establish the diagnosis, and we spend a good time to obtain and to gather such information. And then alcohol drinking, illicit drug use, any time in their life, even somebody has used illicit drugs for one time, it can still exposes or increases the risk of hepatitis C infection. Exposure, more than 50% of the time, high risk sexual exposure is associated with hepatitis B. Long-term medication uses, I mean, one may have a other chronic illness such as lung disease or Crohn's disease or ulcerative colitis, rheumatoid arthritis. We may need medicines to the problem can cause counter problems, and that may affect the liver, because everything we eat, we take that goes into body has to go to the liver as the first pass. And then sometimes we are being overconscious. We try to think that if we take this supplements, vitamin C, iron, or milk thistle, or different kind of herbs or supplements, we think that might help to clean the liver or milk thistle, but it does not. There's no scientific evidence to prove that these liver cleansing agent are supplements, are toxin. They can help liver. No, it does not. It may cause more harm. So the key point here is lesser the better. The only thing what you need is watching the healthy diet, healthy principles. If somebody has had a blood transfusion before 1992, because at the time it was not screened for hepatitis C, hepatitis B, or HIV, so one may have acquired infection from there. And then family history of chronic liver diseases is important. So as I mentioned previously, the fatty liver disease is the most common disease. Almost a third of world population has some degree of fatty liver disease. Certainly not everyone has a severe enough to cause life-threatening situations, but 20% of the 1/3 of the population has a significant fatty liver disease, which that population is at risk of morbidity and mortality. And how we identify patients who are susceptible for the fatty liver disease? These are the patients who have the poor lifestyle, people who have diabetes, people who have high blood pressure, high cholesterol problem, people who have other like a disease, polycystic kidney, polycystic ovarian disease, or so all these information help us to identify high-risk individuals, and that help us to initiate workup to identify. This is how we evaluate a patient with a suspected liver disease in our practice. So once we have a patient comes in for any liver disease, we check for the viral hepatitis, because they're easily recognizable and easily treatable. And so we check for the viral studies. And then if we have like second common, the other common is the fatty liver disease, we suspect that, we take the alcohol history information, and drug-induced liver injury, we exclude them. Then we check for the genetic diseases which can be fixable with them. And then if we suspect them, we do liver biopsy to confirm the diagnosis and do the blood test. And then again, there's an immune system dysfunction, or called autoimmune liver disease, which is called autoimmune hepatitis, primary biliary cholangitis, primary sclerosing cholangitis, and there are many more. So that's a treatable group of the diseases. We do the serological testing, blood test, and liver biopsy, and we can identify it. And then when all these conditions are excluded, then the diagnosis is fatty liver disease. And then we suspect that, and we do two kinds of testing. One, we can do the simple blood test, help us to calculate the score, FIB-4 score, which is a very good test to assure that the patient does not have any significant liver disease. If it's abnormal, it means patient can have any degree of liver problem. And then we can do the FibroScan test, which is very common in United States and across the world, and that can help us. Alternatively, you can do the blood work called FibroSure blood test. So these tests, they have a similar value of detecting liver disease. And if they are abnormal, they can identify that's who is having a significant liver disease, such as cirrhosis. And the people, and then there's an intermediate group where the people may have some degree of disease, but we are not certain what is the degree of damage. In that case, we do the liver biopsy, and the liver biopsy will help us to further classify that and identify the underlying problem, and then eventually leading to the stage of treatment, effective treatment. So this is a simple version of the previous slides. So this is the high-risk patient group. So patients who have the high-risk lifestyle behavior, we check a very simple calculation model. It's derived from the simple blood test such as complete blood count and the liver function test. And two together give us the FIB-4 score. And if the FIB-4 score is less than 1, the chances of having significant liver disease is less than 10% or even less. And then NASH FibroSure test, NAFL FibroScore test, and the US ultrasound can tell you that there is an abnormal echogenicity. So NAFL FibroScore test is also a calculation based on the liver function test, the CBC, weight, and the history of diabetes. And if it tells that a patient is high risk of fatty liver disease, we can identify that. And ultrasonogram, as I mentioned previously in my slides, that if there's a brighter liver on the sonogram, it means that something is going wrong with the liver. So these are the patients who we identify as a baseline in the community, in the population-based. And these tests are typically done in the primary care office on an annual basis. And so once the primary care doctor identify any of such abnormalities, they should be evaluated further appropriately for underlying liver problem. And then this is the stage when the patient comes to us. Then we do the elastography, we do the FibroSure test, we do the further serologic testing to help differentiate between hepatitis, viral hepatitis, immune system problem, or metabolic dysfunction or bad food processing system. And then finally, talking about the diagnosis, if we need a liver biopsy, we do the liver biopsy, and then finally to the stage of treatment. Once we have the confirmed diagnosis, we take it seriously and aggressively and treat them underlying problem. So, as I mentioned, fatty liver disease is the most common problem. There is an epidemic of fatty liver disease in the world. And how we treat that, we take it very seriously. There's no medical or pharmacologic treatment. However, the several studies have shown that if the lifestyle intervention, the behavior changes are made aggressively, timely, appropriately, it certainly helps to resolve the liver problem. It reduces the degree of inflammation. It takes all the fat away from the liver. And above all, it causes a regression of scarring, meaning that a patient at the stage of cirrhosis at stage 4 can come down to stage 3 or stage 2. So what are the things that comprise the lifestyle intervention? There's no universal concept of lifestyle intervention, especially in the United States. American Association of Study of Liver Disease does not provide such comprehensive lifestyle intervention program. However, the European Association of Study of Liver Disease, which is called EASL, they do have the comprehensive lifestyle program, which comprises of watching, like eliminating the bad quality food, such as high glycemic food, for example, the sugar beverages, or the food that contains high content of the processed sugar. Elimination of saturated fat, which comes from the meat and come from the dairy products, and then eliminating alcohol consumption, and then counting the calories, minimizing the excess calorie intake, or you consume the calories but your bodies need that. And then you need to control the micronutrient consumption, being more active, like consuming the calories, so that you can create a balance between the calorie consumption and the calorie expenditure, and then having a good night's sleep for at least 7 hours. So what vitamins are good to take this? Vitamin D, E, calcium, folic, they're normal. This is safe to take that, but rest of the other toxins or supplements available over the counter, they are not safe. An example is weight loss supplements, libido enhancing medications, liver cleansing agent, muscle building agent, milk thistle, excessive multiple supplements, and turmeric, which is very popular these days, but this is toxic. What's the healthy diet? Again, there's a healthy diet from the Harvard School. This is healthy plate concept. So it's shown here. It's self-explanatory. So you can consume fruits, vegetables, grains, nuts, dried fruit, cereals without sugar though, and meat, which is variety of the food, variety of the choices are available, and we need to comprise, make new recipes for ourselves. We need to maintain our cultural taste and then create the new recipes and take it from there. Thank you. In conclusion, the healthy eating, active hygiene, moderate alcohol consumption, though it is controversial, maintaining normal body weight, safe sexual practices, immunization.